ਕਾਲਿੰਗਵੁੱਡ ਦੇ ਵਿੱਚ ਓਨਟਾਰੀਓ ਦੀ ਸਿਹਤ ਮੰਤਰੀ ਸਿਲਵੀਆ ਜੋਨਸ ਨੇ ਘੋਸ਼ਣਾ ਕੀਤੀ ਹੈ ਕਿ ਓਨਟਾਰੀਓ ਸਰਕਾਰ ਸੂਬੇ ਭਰ ਦੇ ਵਿੱਚ ਸਥਾਈ MRI ਮਸ਼ੀਨਾਂ ਦੇ ਸੰਚਾਲਨ ਲਈ $20 ਮਿਲੀਅਨ ਦਾ ਨਿਵੇਸ਼ ਕਰ ਰਹੀ ਹੈ, ਜਿਸ ਦੇ ਵਿੱਚ ਇੱਕ ਕੋਲਿੰਗਵੁੱਡ ਜਨਰਲ ਅਤੇ ਮਰੀਨ ਹਸਪਤਾਲ ਵੀ ਸ਼ਾਮਲ ਹੈ। ਜੋਨਸ ਨੇ ਕਿਹਾ ਕਿ ਇਹ ਘੋਸ਼ਣਾ ਓਨਟਾਰੀਓ ਦੇ ਸਿਹਤ ਸੰਭਾਲ ਦੇ ਮੁੱਦੇ ਨੂੰ ਬਿਹਤਰ ਬਣਾਉਣ ਲਈ ਸਾਡੀ ਵਚਨਬੱਧਤਾ ਦਾ ਹਿੱਸਾ ਹੈ ਤੇ ਨਾਲ ਹੀ ਜੋਨਸ ਨੇ ਦੱਸਿਆ ਕਿ ਮੌਜੂਦਾ ਮਾਰਗ ਦੇ ਵਿੱਚ ਸਾਡੇ ਕੋਲ 50 ਤੋਂ ਵੱਧ ਵੱਖ-ਵੱਖ ਹਸਪਤਾਲ ਯੋਜਨਾਵਾਂ ਅਤੇ ਪ੍ਰੋਜੈਕਟ ਹਨ।
Today, I am very pleased to announce additional steps to improve access to care right here in South Georgian Bay and across Ontario. Our government is investing over $20 million to support the addition of 27 new MRI machines in hospitals across Ontario. This funding will allow patients, including those in small and rural communities, to receive necessary and critical diagnostic imaging closer to home. And for Collingwood General and Marine Hospital, this investment will provide the funding needed to operate your very own, very first MRI. Several other hospitals in small and rural communities across Ontario will also receive funding to operate their first MRI machine. This funding will provide closer and more convenient access to diagnostic imaging for local patients. And I don't need to tell the healthcare professionals in this room what it means to have access to that information here so that you don't have patients traveling in areas and communities that aren't always as easy to travail. With more MRI services throughout the province, patients can be diagnosed faster and, if needed, begin treatment and follow-up care even sooner. This investment is another way our government is ensuring Ontario hospitals have the funding and technology they need to continue delivering world-class care. Thank you again to Collingwood General and Marine Hospital and all hospitals across Ontario, as well as the MRI technicians and imaging professionals across Ontario for your incredible dedication to providing Ontario patients with exceptional care. Our government will continue to work with you and our health partners to ensure our healthcare workers have the tools and resources they need now and into the future, and to continue building a stronger and more convenient healthcare system centered on the needs of patients and families. You know, it's frankly an example of how our hospitals are working together. So when we have high numbers of pediatric patients, primarily because of the virus season that we are experiencing this winter, we have the opportunity through air ambulance, Orange, to make sure that where there is capacity within the Ontario health system, we get that access to the patient as quickly as possible. Look, I get it. It's not ideal as a family to have a child that far away, but it is also important to appreciate that by doing that air transport, that child was able to be assessed and treated sooner. We and the ministry are awaiting a proposal that is coming forward from Collingwood General Marine Hospital, expecting in the next few months. But I want to be clear, you know, our government and Premier Ford has made it very apparent that we will be investing in community hospitals. We've made many examples. In the current pathway, we have over 50